So let me start out with the webpage. So this is the first time I've done this, so please be patient with me. I'm going to share my screen and then go to the website. I hope. Can everyone see that screen? It says, and just give me a thumbs up if you can. It says AOS 94 at the top. Okay, great, awesome. So I am in the right spot. So this is what administrators have been working on all summer long, along with recommendations from the CDC and Maine Department of Education. And this is on the website. You can see the web address up here in the upper left-hand corner. And I would encourage you to use this. It's a very good site. And all these plans were, you know, we spent a lot of time trying to think of every single scenario. And of course, we can't think of them all, but we did our best. If something comes up, these plans will change. But we feel really good. They're a good, solid plan. And the DOE is give us a lot of feedback on it. So this is the main page. You can click on these links, but I'm going to go down through them all individually. So this is kind of the daily screening flow chart. And we'll get to a self-assessment of students' health before we end out in the session today. So this is a flow chart. This is one way to look at it. So on the far right-hand, left-hand side, there's no flags, you proceed to school. If you're exposed but you don't have any symptoms, and we'll get into that more later on, you cannot go to school. And you should probably stay home 14 days. That's what we're requiring since your exposure or positive negative test. Diagnosis, no symptoms, cannot go to school. Diagnosis with COVID-19. Home for 10 days since first symptoms and no fever for 24 hours. And then the last section, if you have at least one symptom, and they're over here on the right, fever, chills, shortness of breath, etc., you cannot go to school. So if you're confirmed positive COVID-19 or a person has not been tested, 10 days since first symptoms, no fever for 24 hours, and improvement of symptoms including coughing or shortness of breath. If negative COVID-19 for fewer than 24 hours without use of medicine. The last one is if confirmed diagnosis other than COVID-19, for example, stomach virus, ear infection, follow normal policies returning to school. So that's one way to look at it. And we'll look at these things multiple ways. So I talked a little bit about the self-assessment earlier. This is a nice graphic that one of our staff members made. And this is kind of the process of thinking you go through when your kid gets out. Before you send your kid to school, you should ask yourself these questions, or ask about your student. Have I been out of state for the last 14 days? Right? Yes or no? And then underneath is you should stay home for 14 days. And there is a list that the governor has put out. I don't have it with me tonight, but there are some states it's okay to go out of state and come back. New Hampshire is one of them. And the list, I'll have to get the list on the site somewhere. But if they haven't been out of state, then they're good to come to school. That's step one. Then you go to step two. Have I been living with anyone who is sick or quarantined? Again, it's a yes or no. Then you move down below. Step three, do I or have I been around anyone exhibiting these symptoms within the last 14 days? Again, yes or no. Step four, put on your mask, wash your hands, and have a great day at school. That's the process you need to be thinking about in the morning. Okay, then upon arrival at school, and this is every day, no exceptions, students, staff, and visitors will be subject to a temperature screening. And I've got it right here. I wanted to show you it, so I'm gonna stop sharing my screen for a moment. And can you guys all see me again? Thumbs up. Okay, good. So this is, I'm going to move it a little bit. This is our temperature screening device. And what happens is the kids are going to, this is going to be their first stop when they come into the building. And this is the same for all all the school buildings. So this is a device that measures your thermal temperature on your face. And I'll give you a couple of pictures to show what it looks like. It doesn't come through on the broadcast for some reason. I think it's because these lights are too bright, but I'll show you a picture of it in a moment. But you can hear it. So here goes.
Please wear a mask.
Did you hear that?
Temperature is normal.
So it said you have to wear a mask. So it prompts you. If you don't have a mask on, put it on. Once that happens, you try it again.
Temperature is normal.
So it's usually quicker than that. If you're not at the right
Please
distance,
wear a mask.
please wear a mask. If you're not at the right distance at it, it doesn't frame your whole face. You have to either back up or go forward or move the device down. And we'll have a staff member right there to kind of monitor this. And if the student doesn't, if he falls outside the range that's safe, we'll take him aside discreetly and ask him some more questions. And then if we have to, if we decide that they shouldn't be in school based on those questions, I'll get the school nurse from the high school and we'll proceed from there. Most likely they'll have to go home. But we don't want that. We want to have all the kids in school. That's why we're taking all these precautions. Let me go back to sharing my screen. Okay, so that's kind of the self-assessment. Once they pass the screening, they go directly to their classroom and they'll be in their classroom all day long. We don't want kids, you know, mingling and, you know, coming in contact with each other in the hallways, passing each other. Not all schools can do this. We're lucky we can do it because our kids stay with our instructors all day long. Lunches, I'll get to in a little bit, but lunches will be brought from the high school over to the tech center and we'll deliver them to the classrooms. All right, let's keep going. The masks. I posted this on the Facebook page too. It's really hard to get all this information out to students before school starts because in many cases we don't have their addresses yet. It's not like a high school or the grade school where they re-enroll or enroll early in the summer. So we have to rely on information we get. And the packet that I'll show you in a few minutes, that'll come home, you guys can look at it and then sign it and send it back if you agree to do it. So mask, cloth masks, face coverings are a must. If a student comes to school and they don't have a mask, we'll give them one. If they refuse to wear it, we will not allow them in the building. That's a non-negotiable thing. If they can't wear a mask and they have a medical reason why they can't, from a physician, we're going to need a documented letter or documentation from a doctor, physician, saying they can't wear a cloth mask. And I heard some, we got some information from a doctor in Dover that handles a lot of this stuff in the area. And he said most kids don't need a cloth mask, even if they have asthma. So we're hoping that we don't have a lot of kids that are going to require face coverings because they aren't as effective, at least based on the information we have, than a cloth mask. But if they don't come to school with a mask, they won't be allowed, and they won't wear one when we give them one. We won't allow them in the building. I hope you will support us with that. We're taking it very seriously, the safety of our students and staff. So everyone wears a mask or face covering if deemed, needed. During all classes, on school grounds, on the bus, during lunch and snack time is the only time you can take the mask, and mask breaks is the only time you take a mask off. We don't expect kids to wear a mask for 6.5 hours or up to 8 hours if they're riding the bus. We will provide periodic mask breaks, and there'll be times when you can snack or take a lunch break and you'll be able to take your mask off. When we do that though, they're gonna have to be at least 6 feet apart, and the teachers are going to have to monitor that and enforce that. And I think the students will be really good about that. I don't see anybody having a problem with that. We're going to get them outside when we can. We're going to have windows open inside the classrooms whenever possible, doors open. We're going to have some air flowing. We're going to set up fans in each room to pull the air out of the building. We don't want to put it just in the classroom where it's going to blow things around. We don't want to blow germs around. We want to take that air and get it out of the room. And if we keep the doors open, we'll be able to create a drawer and get the air out. Most classrooms have some type of way we can get extra air in. Some have air pumps with filters on them, and the plan is to get a air filter in each classroom. It's hard to get stuff right now because everybody wants it. So everybody's, the demand is really high. So we're going to try and get some machines into the buildings, the rooms as soon as we can. Okay, physical distancing. This is another thing. It's going to be 6 feet apart. I know there's going to be times when students, by no fault of their own, they may come in closer than 6 feet. We understand that, but we're going to try and keep people 6 feet apart at all times. CDC recommendation, I think, is 3 to 6 feet, but we're gonna go with 6 feet because we really want to limit contact between kids. The classrooms are going to be set up that way as well. All the desks are going to be facing forward, so nobody facing each other. So if something does happen, aerosol won't go towards anybody. It's better if it's coming from behind the head, not in the area that they're breathing in. It's also required on buses. Anytime you're on a bus or on school grounds, we need to have a 6 foot distance. So this is another way to look at some of this. The plan. We're back to where we started with the main page, and these are little drop-down menus. They're another way to kind of summarize these requirements. So mask coverings, it's all the same information. Adults, including educators and staff, required to wear a mask covering. Students age 4 and above required to wear a mask or face covering that covers their nose and mouth. Students can wear they can bring their own masks in too, as long as they meet the requirement of covering their nose, mouth, and chin. So, some of our masks might not be comfortable for some students. They're more than welcome to bring their own in. They need to be worn on a bus. Face shields are an alternative with a documented medical or behavioral challenge. And the same applies to staff with medical or health reasons. We go to the next one, physical distancing. Again, it's the same information in just a different presentation. 6 feet distance, physical distance required with a mask. And then if we're eating outside, it's still 6 feet. Medical isolation space has been set up in the building so that if a student exhibiting symptoms of COVID-19 during the school day, we can put them in this room, and then we can, move them from the classrooms and make sure that we keep everyone else safe and from spreading germs or the aerosols and virus around amongst the students. Again, the area room in any room or classroom still cannot exceed the governor's gathering limits. Moving on to PPE or personal protective equipment. All students and staff will be provided with 2 cloth masks. Additional safety precautions required for school nurses, and any staff supporting students within close proximity in classrooms or areas that have been used by individual diagnosed with COVID-19 must be closed off until thorough cleaning and sanitation takes place. We do have these. We do have these really augers that disinfect surfaces, so that helps speed up the process. Hand hygiene is going to be another important one. All students and staff will receive some training in proper hand hygiene. Let me just, sorry. And then there'll be sanitizing gel around the school in each classroom, and also when they enter the building. They should disinfect or hand wash before or after donning or removing a face mask, after using the restrooms, of course. And then, not in our case, but if they've been on the playground or any shared equipment, there could be shared tools in some programs, and we need to make sure we disinfect in between those. And also entering and exiting the bus. Symptom screening at home. We talked about this a little bit. Students and staff members must conduct self-checks of the symptoms prior to boarding buses and entering the school buildings. Any persons showing symptoms must report their symptoms and not be present at school. And the daily screening,
Okay, we'll have to check them.
self-screening flow check is important too. And then return to school after illness, a sick staff member or
Don't be
student.
picking at them because they have to go away before states.
Could someone please, someone's not muted. Could you please mute? We can hear you. I don't know who it is, but if you could mute, that would be great. If you've been sick, members of students must use home isolation until they meet criteria for returning to school. So that's the webpage interactive stuff. And then the COVID-19 return to school guidelines. These are for students and families. This is the document that will be coming home with students. And it talks about the same information we've already gone over in a couple of different formats. And I'm not going to read it all to you again, but there's a section on why we think that this is important and how we came up with these guidelines. Talking about the daily self-assessment again. There's this flow chart again for screening for COVID-19. Talking about face coverings and masks. And this is more detailed than what we've been looking at, but it's the same information. And I would point out right here, it says maintaining a 3-foot distance is acceptable between staff members. This is, again, this is the CDC recommendation. We're going to use 6. So I'm not sure why this is still in here, but we're going to use 6. Students are going to be closer than that at times, but we're going to try and reduce those as much as possible. And it talks a little bit about, you know, using masks in the van or bus, face shields as an alternative. Prevention measures, excuse me, proper hand washing guidelines are going to be very important. The mask is important. Not congregating as a group of students is going to be very important too. That's why we're trying to keep them separated during the day as much as possible. Food distribution and meals. At Tctc, kids are going to remain in the classroom for all snack and meals. And so this is how it's going to work at Tctc. We're going to send a lunch count over in the morning. They're going to prepare some lunches. They're going to be cold lunches at first. I'm going to try and work in some hot stuff as we go on. And I'm going to pick up those lunches at the high school and bring them over here. And I'm going to deliver them to each classroom. So that way the students don't have to come up to the common area, get their food, or even go to the high school to get their food like they previously have done. We don't feel that's a safe way to do things. So I'm going to deliver their lunches to them at the classrooms. And hopefully, again, I really, there's nothing like a hot meal sometimes, especially this winter. So I'm going to try and get some hot food worked into that. We have a culinary arts program here, so I think we can do something. Playground use, this is really elementary, but it could apply to, you know, shared equipment and tools in some of our programs. Special education, students with special needs. There's some additional guidance on that with those students. And if you have a student with special needs, please read that a little more carefully. In transportation, we are encouraging parents to transport their children if possible. I know lots of times it's not possible, especially where we're grabbing students from, you know, all over the county. So all over 3 counties actually. So it's going to be hard, but if you can, that'd be great. We're not requiring it for sure. Students are required to wear face covering at all times while on the van or bus. Of course, we've talked about that before. And there's some more guidelines here. And again, I don't think it's productive to read them all. Windows are going to be open on the bus to improve air ventilation. We talk about vans a little bit here. And I am going to read this one though, because I think it's important that you know it as a parent or guardian. Bus drivers will clean and disinfect frequently touched surfaces between uses as much as possible. High touch areas in buses such as seat backs, handrails, stability poles, bars, windows, and window ledges are going to be cleaned more frequently. Probably after all the kids are off, we're going to go through and do that. And then spraying buses is another possibility. Again, it's a quicker, more thorough way to do it. And we're trying to do it the best way we can. Parents and volunteers or guardians in the building. Of course, you know, we'd love to have parents in the buildings. We have to minimize that during the COVID outbreak. So there are times when you have to come. And you know, your student, you want to meet with your teacher about your student, or there's a discipline issue or IEP meetings or anything like that. We understand that, and there's some guidelines here if you want to enter the building. The ones that are very important, again, wear a face mask, face covering while in the buildings, maintain 6 feet, social distancing, and then do your specific business and then leave. I know that sounds very unfriendly. That's not what we're shooting for. We just want to keep everyone safe. Technology, I think at Tctc, this isn't going to be an issue too much, but we don't have a hybrid model. We're going every day just like normal. So the normal T1, T2 schedule is what we'll be using. And all the schools, all the sending schools are agreed to do that. So we're not going to get going until all the schools won't be in session until September 8th, but Tctc will be open on September 2nd. And I think all the schools except Nokomis will be sending their students. So we're trying to get things as normal as possible, get the kids back into school, and you know, start educating them. Classroom setting, if in-person instructing, classroom seating will be configured with minimum allowable space between students and all desks facing the same direction. I talked a little bit about that earlier. Employees are going to modify the instructional plans to reduce student contact. That's important, sharing materials, equipment, and they're going to maintain physical distancing. And common or high touch surface areas will be sanitized throughout the day. And we're actually receiving some training on this tomorrow at a AOS-wide training, how to disinfect. So that's part of the rules. You have to train each teacher on how to disinfect their classroom, and they'll be doing that. Remote learning. Any SAD 46 students across K through 12 have the option of participating in remote instruction. This is a possibility for Tctc students too, but where it's so hands-on, there's only so much you can do through the computer and remotely until you have to certify them for their CDL license or their CNA license or things like that. It's going to be tough. So we're hoping that students feel comfortable enough and safe enough to come here every day. And if something happens, we'll work with that student on an individual basis. But we'd love to have them here. And that decision may be taken out of our hands, but we're hoping not. Because you can't replace a teacher in the classroom, I don't think. I mean, there's some really good distance learning stuff out there, but, you know, in-person instruction to me is the best way to do it. Some expectations around if you choose to do remote. Remote learning programs will be fully graded and credit bearing. This was a problem we had in the spring. I think everybody went into, lockdown and shut down and no school so quickly. We were really worried about students, their social, emotional learning, their mental health. We didn't want them to, be overwhelmed with, school, because at that point, school really wasn't the most important thing. It was, staying healthy and with you and your family. So things were a little different then. We've had all summer to plan and get ready for this. So there's going to be more accountability for students beginning in September. So I just wanted you to be aware of that. It's not going to be the same as it was in the spring. And they do say here there's if you choose to participate in remote learning at the beginning of the year, you have to stay in it till at least the first quarter or trimester. In our case, it's quarter before you can come back to in-person learning. And then if your student has a 504 or an IEP or things like that, ITI, ELL, we'll provide those services remotely as well. And then if you're sick, these are the same guidelines that we talked about earlier. But what I want to emphasize in this section is that if you do get sick and you're diagnosed with COVID-19, we're not going to penalize you for not being in school. Okay, if you're at home, you have to quarantine and you show up for your scheduled distance learning classes, you'll get credit for it, and your attendance won't be held against you. I think that's really important. And then again, the expectations, if you test positive, parents and guardians will notify the school nurse if their child or anyone in the household has been confirmed to have COVID-19. We really want to protect our students and staff. This stuff can spread pretty quickly, as we found out with the Millinocket case. Under the current Maine CDC guidance, a student who has tested for positive for COVID-19 will not be able to return to school unless they've gone a whole day without exhibiting symptoms of COVID-19. At least 10 days have passed since the student's symptoms first appeared, or the student has received 2 negative COVID-19 test results from specimens taken more than 24 hours apart, and documentation of medical clearance will be required. So those are the things that have to happen or be in place before they come back to school. Then they talk about a little bit about contact with other students. So close contact is defined as any individual who's been closer than 6 feet for more than 15 minutes. So that's and again, that's the CDC definition. And at the very end here, this is important too. During the time students are out of school, arrangements will be made to ensure that they do not fall behind in their learning. A student shouldn't be penalized for being sick. So we want to do everything we can to help them stay on track. Again, it talks more about the expectations if you're quarantined. And then towards the end of this document, there's some training videos you could watch that are in here. These are hyperlinks. So if you go to the website, you'll be able to link to the video, and it'll help you understand, or even train some of or get your students kind of used to what to expect when they get at school. And I had posted some of these on the Facebook page. And then we're going to ask its parents and sign this document agreeing to what's in it. It gives the teeth a little bit of, it gives the document a little bit of teeth, the policies. Again, it's intended to keep everyone healthy and safe. And that's the goal of this whole plan. So let me stop sharing out of this document. Let me see. Okay, I'm back in the website. And there's some other documents here you can look through at your own convenience, but learning resources, Power School Unified Classrooms for students and teachers, that doesn't have, well, the remote learning has some things to do with the COVID-19 guidelines. But look through those at your own convenience, and they're kind of lengthy documents, but I think they're worth reviewing. But I don't want to spend time here tonight going over these. I'd rather answer questions about what we've talked about so far. And then this is the parent forum that they did at Ridgeview with Mr. Jordan. If you want to watch that, it's there. And then some other YouTube videos for students and parents, and then some mental health videos and so forth. So it's a pretty comprehensive site. So what I'm going to do now is I'm going to go out and first see if I have stop sharing. Okay, I don't have anyone to add. That's good. Okay, so now I'm going to go to the chat room. And can everyone see me again? Okay, good. Let's see. What about kids with asthma that cough a lot? Yeah, I talked a little bit about that probably after you posted your question, but again, we felt that the guidance we got from the doctor in Dover, he said that asthma actually helps kids regulate their breathing. And he said that it's a rare case that a student that has asthma will not be able to wear a mask. That's not my call to make. That's individual doctors' call to make. So, and I don't know all the students either. So it's got to be on an individual basis. So if you can't wear a mask and your doctor says it's not conducive to learning for you, then we'll have to go with a face shield. Is that, I hope that answers your question. And you can unmute if you want to go further into your questions now. I just don't want everyone unmuting at the same time. How does physical distancing apply for programs like the EMT program or the criminal justice, which to my understanding normally includes physical interaction in practice? Yeah, you're right, they do. We're gonna have to come up with some kind of alternative way to teach those skills. I know, like, I've taken a CPR class, and they use the alcohol wipes and things like that. They can do some of those things. Hopefully, this is all gonna be lifted at some point this school year. So the instructors are gonna have to work really hard to modify maybe their sequence as well. But we're just gonna have to do the best we can. But we have to keep that 6 foot if at all possible. I don't know if that answers your question or not, but. So another question. So when is Dexter supposed to start for tech? We start on Wednesday, a week from today. Again, we're going on a T1, T2 schedule. Wednesdays, we're including Wednesdays. I know some schools aren't going on Wednesdays. I think Nokomis isn't. But they're still going to they're still going to send kids to the tech center. So I appreciate Nokomis for doing that. Please talk a little bit about what you expect of the students in the early childhood program that attend Nokomis since they start on the 8th and TC is opening earlier. Will they start remotely with their students and begin on site on September 8th? We're working on that currently. I just confirmed that Nokomis was not going to send a bus up this Wednesday, Thursday, and Friday. So what we'll probably do is do something remote with them. And Allison, maybe this is Allison on here, but Allison Gudrow is the new instructor down there, and she's going to be doing a great job. So I think probably what she'll do is do some online remote stuff with those kids until we start up. It's only really 2 or 3 days. They'll be in a remote learning thing, and hopefully that will be enough to keep them going. And I think that's how we'll have to do that. Okay.
How do we know if the Dexter kids, what color Wednesday will be?
It's, I'll provide them a schedule. Let me see if I have it right here. I do somewhere. So this is, I don't know if you can see this, but this is the Tctc calendar, and it's got blue and white days on it because that's what our colors are. Dexter's a red and white day. So you'll see the Wednesdays have either blue or white. So that's how they'll know.
Okay, so when will we get a copy of that?
It'll come home with them the first day they're here. So your sending school will let you know when. Actually, I could probably post this on the Facebook page. How about
Well,
that?
I'm only saying because Dexter said the 4th. The kids were starting the 4th. And you're saying Wednesday.
Yes, we will be open. Yep, that's a great question. Thank you for clarifying. Yeah, they are, Dexter kids, the freshmen are doing their day on the 2nd, which is the Wednesday.
Yeah.
So there's no
It's
kids
the
coming.
freshman new kids. And then Thursday they said was they're gonna do the first, the A through J or whatever it is gonna do Thursday, and they're gonna do a red and white day that day.
Yep.
And then Friday is the other half. So that's why I was saying if it's Wednesday, then how do we know?
It's my understanding that if they have tech during those days, like if they're red 1, 2, 3, 4, 5, and that's their tech day, they'll be coming over.
Right, but Wednesday we won't know because we don't have the schedule for Dexter to say what Wednesday is, whether it's a red day or a white day. We
Right.
don't have this year's school schedule yet. They won't get that until Thursday.
I have on my calendar the
That's
second being a white day.
That schedule is posted red and white right on Dexter High School's webpage. I just looked at it.
Yeah, it is. Yeah.
Okay.
But and Crystal, the second is a white day, correct?
I don't have it. I'm not even Dexter. I'm Penquist, but was just scoping out their page and did come across it.
Yeah.
Okay.
It's a white day. So if they're not a freshman, we generally don't take kids on that first day, but from the other schools, if they're coming, then we'll take if it's a white day, it's a white day. So those kids will be coming to the tech center during that time.
Okay. And the
And
other
I
thing
will-
was, as far as the cough goes, is like he has asthma and coughs all the time during his asthma. You know what I mean? So is
Right.
that going to be an issue because that's one of the symptoms? You know what I mean? Or are you guys going to need a note? I mean, he has his inhaler, but that doesn't always cure it.
Yeah.
You know what I mean? This doesn't always.
I think, yeah, that's a good point. I think, it's like when you're in a restaurant or something, somebody coughs, right? I mean, they don't have masks on when they're eating. Everybody looks at them, right? Like,
Right. And that's what I'm saying. How is this going to work for somebody who has asthma? I get the mask. I understand the mask thing.
Yeah.
But if he's having a really bad day, he's coughing a lot, and the inhaler's not really helping a lot, and he's in school, is it going to be an issue? And if so, then what do we need to do for that?
well, I think if we know he has this, he coughs and has asthma, we'll know that about him. And we'll get to know these kids, really quick, because they'll be with their instructor all day long. So I'm hoping that, we'll know that about him, and he'll be temperature scanned too.
Right.
So that he won't show, high. So
No.
he'll be okay.
Okay.
Yeah.
Thank you.
Good question though, because
Ryan?
and we're all learning here. We're all, it's like this the first week we'll be changing things to make it better, and it's just we're going to do the best we can. Hopefully
Ryan?
keep it safe. Yes,
If I may interrupt,
you may.
I think the wording for the symptoms is new symptom. So if it's a pre-existing cough that he's had all along, I think he'll be fine.
Yeah. This is Sarah. She works at the tech center with me. She's the student service coordinator.
Right. I knew it won't be a new symptom. I mean, Ridgeview is having me get a note from my granddaughter, just saying that just because she has a cough doesn't mean that she needs to be pulled out of school because she has asthma. Is that something that you guys are going to require so that, I know he doesn't have a fever or anything, but, to cover all bases so I'm not getting a call every day.
I think if you could send something in, that'd be great.
Okay.
Or even
That's-
just a note from you saying, hey, this is the situation. Just be aware. All right, let's see. What about graphic design communications? Will they be able to do any remote learning? Graphic design and communications is one of those courses that is, does lend itself to distance learning. So if a student needs that, we can do that for them. Yeah. And just so you know, the classes, our classes this year are kind of small. So there won't be a lot of kids in there. So I've posted that question. But yeah, it's always an option. We'd love to have them here, but if they don't feel comfortable here, or parents don't, we can do something remote as well. That, again, that's one of those courses that can or lends itself well to distance learning. Can Tacoma students attend in person if they have transportation? Yes, they can. We have a parking lot to the down on the right here, the building. They can walk in, get scanned, and then go to the class. I have additional parking out in the Dexter High School parking lot if needed. So that's definitely an option. And there is some paperwork you got to do just to register your car so we know whose car it is in case there's something comes up. That's all. But they can, yes. For programs that include physical exertion, like the fire program, criminal justice EMT, how do they work with mass? Yeah, field trips and clinicals going to happen this year. Field trips and clinicals will happen. Clinicals have to happen. You can't get through a CA. You can't get your CNA license without it. We actually got 24 kids through it last year, throughout the summer. So they all passed their exam, and they're all in their clinicals right now, and some have finished them. So we did the same thing with CDL, the truck driving license, truck driving program. We got 6 kids licensed out of like 10. So I think that was pretty good. We had some excellent instructors who worked all summer long, gave up their summers so they could get these kids licensed. Fire program and EMT, again, they're gonna have to, I know the instructor does physical training every day. This fall won't be an issue. He can go outside and do it. But down at the mill where he is, we've talked about having the 3rd floor as a physical activity place. So that's something we're working on. So hopefully that will work out well. Yeah, criminal justice, I haven't talked to the instructor yet what his plans are. Again, the fall, could go outside, which is the best option if it's not raining. And he has used the gym, high school gym at times too. And the guidance right now says if you're outside without a mask on and you're physically exerting, you have to be 14 feet apart. So it is possible. Let's see. My daughter's taking multimedia. How will that work out? And does she take the regular bus? And what day is she in school? Is she supposed to be on Mondays and Thursdays? What school? I guess I would need to know what school she's in or coming from. But if she's in multimedia, she's going to adhere to the same T1, T2 schedule that every other student does. So it'll be 2 days, 1 week, Dexter, Monday and Tuesday. Yeah. So the tech kids, and Sarah, correct me if I'm wrong, the tech kids is supposed to be coming on the T1, T2 schedule. Yep. So if she's in the multimedia, so what they'll do is they'll come to school, they'll come to the tech center, and then they'll go through the screening, and then we will have an area for them to wait for the bus, because there's a bus that comes from Milo. Then they get on the Milo bus and they go to the mill. I know this is confusing, but that's how it all works out. Then at the end of the day, the Milo bus will bring those kids up to the tech center. The Milo kids will get on the Milo bus and go home. Is that right, Sarah?
Sorry, I was muted. Yes, that's the way it goes. So the kids come to the tech center, Milo bus picks them up, drops them off down at the mill. And at the end of the day, when she comes back from Milo, she picks them all up again and brings them back up to the tech center.
Yeah.
And I just saw the question pop up, what about students who drive but attend the tech center at the mill? That's correct. There is no parking down there. The students do have to be transported from the tech center down there on the bus.
We have had some discussions with Frank about Frank and the instructors down there. Frank Spazuko owns the building, and Bill and Nelson Cole. And we may, you know, our concern there previously was that the kids had to walk across that road, and it was a pretty busy road at the time. But, you know, what's the bigger risk, having them come here or having them go across the road? We're trying to weigh that, and we have had some discussion about having them park over at the Shop and Save or Hannaford, whatever. It was always Bud's when I was here as a kid, but the supermarket across the road. So we haven't finalized that decision yet. So that might become a possibility, but they can come to the tech center then. At least initially, that's what we'll do, and hopefully we can work something out with the Shop and Save. That's all the chat questions. Anybody want to ask a question online, or I mean through the voice option? I know it's a lot to take in.
Yeah. Anne Girardi posted a question here about the EMT students from last year who didn't get licensed or have their clinicals. I think Mr. Wentworth has something in mind. So I'm not 100% sure, so don't quote me on that, but I do think he's got something in mind for those students to be able to follow up with them.
Yeah, and I apologize for missing your question.
So if he has something in mind for those former EMT students, but those EMT students are going into other programs at Tech, is that going to possibly conflict?
Sarah?
I don't think his plan's gotten that far yet, to be honest, Anne. I just know that he does not want to leave you guys out of the loop. I know he wants to take care of all you folks. And I know I've talked to him about this a couple of times because my own son was in that class last year and wasn't able to take that final certification exam. So I'm interested to see how this works out. And he is in another program this year, so it does affect him. But we will be in touch with all of the former students, even the ones who graduated, to see what we can do to help them out.
Awesome, thank you.
Thank you, Sarah. I wasn't around when that all happened, so that's why I deferred to Sarah. And I'm glad she tuned in tonight. Appreciate that. Any other questions?
I have one. If you say Wednesday is a white day and
Yeah.
then they're supposed to start Dexter on Thursday and it's a red day and they're technically supposed to be in tech, but it's going to be Dexter splitting the day, is my understanding from talking to Mrs. Toll, is that Thursday would be half red day, half white day. How is that going to work if they're supposed to be in tech that day?
I think, if I understand this right, when they, if
I have that letter at home somewhere because I got a letter from Mr. Bell because both of my sons go to Dexter. And from what I read in the letter, the half of the day that is their tech day, they will be attending tech. So if half of the day, the first half of the day, say, for example, is a red day and their tech is red day, they'll come over for half of the day, and then the other half of the day, they'll go back over to Dexter.
right.
Okay, so they're going to split that then, right?
Yeah,
That's what I'm
yeah.
saying, is if they're required to be a tech, and technically, I know his tech is on a red day because I've already got his schedule. So technically, he would be in tech on that Thursday instead of doing the half a day, is what I was asking. That's what I was wondering. If they're still going to allow him to do the half a day.
The half day, yes.
Yeah, okay.
Yeah.
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 You.
Yeah. Any other questions? Oh,
Sherry just asked, Sherry, it looks like, and unmute just so you can answer this quick question. Your daughter is you're from Nokomis? And Karen's question about Nokomis too. Nokomis is going to send kids to Tri-County every day once they get in the rotation.
Yeah, I talked to Mary Netto this week, and she said that she's on the T1, T2 schedule, and they're sending kids on that Wednesday that they're closed, that the school's closed. So I think there's some confusion somewhere about that.
So are certain programs on certain days? Or is he going to be going Monday through Friday to Tri-County? This is new to me.
No, he'll be, if he's on a T1 day, which is the blue days, this is all confusing too, but
Yeah.
those are the days he'll be here.
Okay.
And the white days, if he's a white day, he won't be here. So he's going to be here 2 days one week and 3 the next.
Okay.
Karen, what day is he on? What day is it? An A day or a B day for Nokomis?
Yeah.
I just got a schedule today. Let me grab it.
Because whatever his day is will correspond to our either T1 or T2. And I don't have the cross chart in front of me right now. So he would be coming on whatever his day would be on an every other day basis.
Yeah, so, yeah, it's weird because we have like group 1, group 2, and then we have A and B days that they split them. So it's weird to read this. But like Monday, oh, that's a Monday. This is what I've got.
Yeah.
It's all Greek to me. I'm still trying to decipher it too.
Maybe
Like-
when you see my schedule, they might gel. I don't know.
Maybe
I'll
it'll
post that on
do.
Facebook soon. I can't do it tonight. I
Okay.
have to go to a school board meeting in 10 minutes, but I'll,
Oh, lucky you.
yeah.
But
Yeah. Skills USA, I talked to the person who was in charge of Skills USA today, last year today, and he said that they're talking about something virtual this year. So I don't know. They tried to pull that off last year and it didn't work. So we don't know the outlook. We'd love to get kids there, and we'd like to have kids compete and show what they know to the world. So I don't know what the future is. I don't have an answer for you today, Ann. I'm sorry. Yeah, I'm looking at the comment about the question about Nokomis schedule A/B days. No explanation about how that lines up with T1, T2. I guess what I would do is I'll post the Tri-County calendar sometime between now and tomorrow morning, and look at your Nokomis schedule. If it doesn't make sense, I would give Sarah a call. Is that okay to do that, Sarah?
That's fine, but what I can do on the Facebook page is I can do a conversion chart for each school's days, comparing
Okay.
them to T1 and T2,
Yeah.
because Nokomis has A and B, Guilford has blue and gold, Milo has red and blue, Foxcroft Academy has A and B, but they're flipped from what Nokomis has. So I can set that up. I can do that little bit of research and I can put that up on the Facebook page.
Okay. That'd be great. So do you need me to post the TC? I'll still post a TCTC
Yeah.
schedule.
Yeah.
Okay. All right. Yeah, it's really difficult to get 5 or 6 high schools on the same page with schedules. Not even imagine, just to get us on the same dates and then get a schedule that agrees with everybody. It's tough. It's tough. I'm gonna share my screen just for another moment because I wanted to show you those pictures that I didn't show. I can bring them over here of the thermal screen and image. So this is, everyone see that okay? This is me passing the test. So you can see there's a kind of a halo there, dotted line, your face has to get within there. And this one said that my temperature is 97.7. So I passed. And I don't know why I didn't say put your mask on. It probably did. I just didn't get it in the picture. And then this other one with my mask on. Oh boy. Here we go, sorry. My mask on, I passed. Normal temperature, again, 97.59. So I just want to show you those, and that's what your student will see every day, something like that. So I want to just take any last questions before I go. And again, you can call or text on any time you want. Sarah, can you post the number in there on the chat? Phone number. And you can email us too anytime, call. We want to have your students have a great experience here. And we want to get them the skills so they can have a decent start on their career, whatever that might be. We have some great programs here, some great teachers, instructors, and staff. So we welcome you to come in anytime you want, as long as you again, you have to have all that social distancing stuff, and maybe that stuff will lift out in the spring, and I'd love to have you come in and see things. Just can't do it right now. But
Is Tech following an 8 to 2 schedule or an 8:30 to 2:30?
8:30 to 2:30. But the buses will be coming before then.
Okay.
And I don't know exactly when those come yet either, because they have huge transportation issues right now. But it won't be too much different than we're gonna start the kids at 8:30, get them out by 2:30 back on the road. So it'll be, I'm not sure what it'll be. We'll kind of have to wait and see what it is. But they have to go back to their regular school so they can get on their regular buses and come home.
Well, I asked Sarah, because Dexter does advisory and they're still doing that on Wednesday from 8 to 8:30. So if we're transporting our kid and the advisory is being done virtual, and because Dexter is shut down on Wednesday, how is that going to work? You know what I mean? Because his class isn't even going to get done until 8:30.
Yeah, I don't know. That's a good.
So then we have to drive him there.
That was my answer too. I don't know.
Yeah, and I asked the school because originally Mrs. Toll said that they could go in the cafeteria and use the cafeteria, but we're being told as of yesterday that no, the school is shut down, that they're not allowed in the school on Wednesdays. So how is that going to work?
I don't know. I'll have to ask Mr. Bell.
He didn't know either.
No.
He said to bring it up in tonight's
How am I
meeting.
supposed to know if he doesn't know?
He said to bring it up in tonight's meeting, so that's why I'm bringing it up.
Yeah.
It's
Okay.
What program is he in? What program is
auto.
Brandon in? Auto.
Auto.
Just thinking maybe you could bring him in and he could do the advisory from the auto classroom.
Yeah, I didn't know how early they could be there. I mean, because I'm transporting anyway, so he doesn't
Right.
ride up.
There'll be someone here from 8 o'clock on.
Yeah. And I'm usually there at 7:30, so because I got to bring my kids in and I got to be there.
Right, and that's
Shoot me an email. I gave you my email address.
Okay.
Shoot me an email and we'll figure it out.
Yeah.
Okay.
Yeah. And I think a lot of these kids are going to be a case-by-case basis too. So.
Yeah.
Well, I think you're gonna have that question for everybody that goes to Dexter that has to do tech on Wednesdays.
Yeah.
You know what I mean? Because they have to do advisory is everybody on Wednesday from 8 to 8:30, and it's done virtual. So they got to be somewhere that they can hook up to the internet.
Is it going to be every Wednesday? Even
Every Wednesday.
Dexter does advisory every Wednesday.
Okay.
So that's why I'm saying it makes it a little harder.
We can come up with a solution. I just don't know what it's going to be right now.
Then you and Mr. Bell can discuss that and then let everybody know.
I will. Solve the problem.
Yeah.
So Sarah's put the number on for the info too. Does that answer your question, Sherry? Okay. All right. Okay, so again, I want to thank everybody for coming and tuning in, and I think we're done. And enjoy your night, and I'm going to a school board meeting. Fun. All right, thanks.